together. Mr. Hall, I'm gonna excuse him, he's on his way to A&L and National meeting that's happening in town. So with me are my colleagues on the committee.
L.B. Gray Jackson.
Dick Trainee.
Tim Steele, I'll sit in for.
Mr. Hall, very good. You're in his district, so that's
That's right.
more than welcome.
He's
And we thank you. Before I get going to this moment, I'd like to just acknowledge and recognize the tragedy in Paris, France here that's happened this past week. And we just ask you to keep folks in your thoughts and prayers. It's, I think there were some Americans that were over there. I haven't yet seen all the I believe there were some Americans that were over there. I hope there weren't any Alaskans. I don't know of any. But just keep them all in your thoughts and prayers as we go along. Also, don't worry about it. It's not municipal taxpayers. Call them and pay. There's croissants and chicken salad and some pumpkin pie back there and some water. It's effectively for lunch. So please feel free to have something. And if there's leftover, as always, put some in your pockets. Take home with you, whatever you got. Be careful about the pie. It might spill your but it's all good stuff for later. All right, so we'll start with reports, and I see Mr. Frost made it good. I appreciate him making it in on this cold day. Chief Tully, welcome,
Yes.
sir.
Good afternoon, sir.
And I understand you had some information you wanted to share with us about SPICE and perhaps anything with the department. Is there any significant announcements we should know about?
Nothing significant in that aspect, but since you brought up the Paris attacks and so on, we are working with our federal counterparts as well as state law enforcement, and I can assure you the communication is excellent right now, and that no one's being kept in the dark, and nothing to report to you that you should be alarmed about it at this point in time.
Good.
Certainly, if there was a message to get out to the community of concern and so on, we would do just that.
Thank you, sir.
With that being said, since the passage of the new SPICE ordinance between November 11th and 16th, APD has issued 7 citations related to SPICE. 6 were for consuming, 1 was for consuming and providing, but it was not selling. The individual was sharing. And each one of these, none of them were arrested because they each needed medical attention. And again, the focus of these citations are not necessarily target the user population and so on, but sometimes the information we gain from those, taking those steps, helps us put the pieces of the puzzle together to find out who is supplying or manufacturing of this spice. And for obvious reasons, I can't talk about those investigations, but they are underway and we are making progress. I'm happy to report.
That was one of my questions. I know any questions from the chief. One of my questions was, and I fully understand particularly investigations that are ongoing, we wouldn't be able to share, but we would like to know if there, at the conclusion of an investigation, if this ordinance was of some help, significant help. If we have to tweak it or adjust it, we're more than willing to do so. So, I mean, it just takes a couple of meetings to get it through the process and get it voted on, and of course, take testimony from the public. So we appreciate
Yes, sir.
the updates.
Mr. Chairman.
Yes, Mr.
Can I just invite Mr. Frost to please join us at the table? Thank you, Mr.
Absolutely.
Chairman.
He's actually listed as part of our board council. And Mr. Frost, we have lunch as well, so we figure out something. Mr. Steele.
Yeah, I was just an indication in terms of, I hope you're seeing less on the street because of the ordinance. I hope that it's already had a deterrent effect. Is that the case, do you think?
It's pretty early then.
Yeah, it's pretty early to tell. We are not seeing a lot of traffic right now down around Beans or any of that, but it's hard to tell if it's just a lull between shipments or if it's the weather. It's just too early to tell at this point.
So I know who you are. Could you identify we're on the record?
Yeah, I'm Lieutenant Mark Peel, and I run the vice unit at APD.
Any other questions, comments? Chief, take it away. Anything more?
That's it.
I understand that there may be some movement within command of at the police department. Is there anything that you'd like to share?
Be more than happy to share that with you.
Thank you.
This past week, we announced the promotion of 2 lieutenants to the rank of captain. The first one is Justin Dahl. Justin will be taking over as the administrative captain. We really look forward to his talents and expertise as we navigate through these multi-million-dollar, multi-year contracts involving the 911 center and other systems. So we're really happy to have somebody that's going to be vested in that and can provide some real expertise. The other one, with the retirement of Michelle Booker in another week, we've appointed Lieutenant McCoy. And Lieutenant McCoy will take over patrol, and we're very excited about that also. He brings a lot of experience with him, and as our numbers grow and so on, I think he can help us getting officers out into the community.
Perfect. Thank you, Chief, and congratulations. I know it's trying to build a staff, a command staff in particular, and as you coming in new, you want to be able to have a good support staff there to help you carry out the mission. So, good picks, for my record, good picks. And I hope we'll see them before the Public Safety Committee meeting, whether they're acting or coming in.
Their official promotion date will be next Monday, and then we hope to get them before you. I also am happy to report out of the 11 eligible lieutenants, 9 of them put in for the position. Actually, out of 12, 1 had just retired before the process was over. The other one was ineligible due to education requirements, and the third one had felt that he had not been in grade long enough as a lieutenant that he would be a good candidate for a captain. So we had the remaining 9 lieutenants compete for those captain position, which was very impressive, I think. So we're in the process of, we do not have a lieutenant's list right now, and we're in the process of next selecting lieutenants to fill those vacancies, and we're hoping that the same enthusiasm amongst the sergeants will be there for lieutenant's positions.
Very good. Thank you, Chief. Appreciate it. Anything else going on in the academy?
So we had an academy class graduate a couple weeks ago. We have another one starting at the end of the month. We've screened and cleared 16 individuals. We're trying to fast track to another 2 individuals, which we're hoping to start with 18 in this coming academy class.
And you're saying the end of the month?
November 30th, I believe, is the first day. We're going to wait till after the Thanksgiving holiday. Then, once that class is started, it's going to become a priority of the department to recruit and do our best to get as many individuals as we can. We're meeting with members of the community, various community groups, asking base faith organizations as well as community groups and neighbors, hoods and so on to do their best to encourage their neighbors to step forward and commit to public service, as well as family members and so on.
Very good. Mr. Trainer.
Chief, can you just give us a racial breakdown on the last 2 academies and this one? I just want to make sure we're representing the population base as we reach out for new police officers, and if we're not, then we need to target our recruitment. So just give me a racial breakdown, if you will.
Yes, sir. I would have to get you those figures. I know from attending the graduation, I was somewhat pleased that there was a bit of diversity there. However, I don't want to misstate something, so if you don't mind, I'll get you those exact figures and report those back to you.
Thank you, because we've got a lot of Islanders here, and I want to make sure we're starting to reach out to the Islanders.
Yes, and
Thank you, Chief.
we'll do just that.
That's great. Excellent.
No, thank you, Mr. Chairman.
Thanks, Chief. Anything else?
Nothing else right now.
Lieutenant Thiel? Chief, I know you have 2 o'clock, so if you have to leave, we understand. You're welcome to stick around for our riveting. Public Safety Committee is usually pretty jam-packed with action items as well. Mr. Frost, I know we've got you on the agenda. If there's anything that you have on any of the updates, I know that we've had one tasking, and I know that we've gotten a report back from both police and fire reference, or health department reference, what their view is from that one particular neighborhood, I believe over in Sand Lake area. Is there anything that you have?
There really isn't. No, our east 79th property's moving, our west 79th brother's moving right along, so it's slow, but she actually is moving.
Okay, understood. And we'd definitely, if there's anything that needs adjustments in codes, I know we're always looking at things to do to help you and your shop.
And we appreciate that. There are a few tweaks that we'd like to do.
Okay, please let us know. All right, Chief LeBlanc.
Good afternoon, thanks. A couple things. One, we had a regularly scheduled monthly medical advisory board this morning with representatives from the hospital's medical director, Dr. Mike Levy, the fire department, Doug Dombrowski with ASP. Good meeting. We gave an update on Spice transports from the period July 15th through November 17th. Total patients transported by AFD during that time period, 6,881. Of that, 873 were suspected having used the synthetic drug Spice.
Can I get
That
those?
represents, and I will send you this.
Okay, I was gonna say, if I could let you
This is just fresh off the press.
Let's see, copy that.
This represents 13% of all of our transports, about 5 per 24-hour period for the period, although, as was noted earlier, that the number has decreased appreciably over the past couple of weeks. 32 of those patients required advanced airway interventions, intubations in the field. I don't know how many get intubated in the emergency room, but a number do. We also have
If you don't mind, sorry, we have a
Thank you,
question.
Mr. Chairman. What was the time period again for those statistics?
July 15th through November 17th.
Thanks, sir.
Yeah. 32, again, of our patients were intubated in the field. This is an update to a very alarming statistic. One patient has been transported 21 times. Another patient 14 times. 2 patients 11 times. 2 patients 10, and then 1 patient 9, and then we stopped counting at that point. So 21 times in 4 months. Again, mid-July, July 18th appears to be the date of the beginning of the current Spice issue. For comparative purposes, I think I mentioned this before, January 1st through July 4th, well, a 10-day period review over the past 2 years. We transported 88 patients in this 10-day period this year versus 7 last year. So it's, while we had some examples of Spice last year, it's truly a 2015 initiative. We haven't relied on JBER for assistance, but of course, Chudiak is always available for us, as well as JBER for additional medical needs. You may recall, I think I mentioned this last time, October 19th was the most explosive date we've experienced, with 31 of the 64 total medical transports for the day Spice related. That was 48%. And as we've known, the ordinance has gone into effect. We're hopeful that it is having an impact, although I suspect the cold is probably the most significant deterrent, although we have been responding to Spice patients today, particularly in the Third and Carlock area, found down outside of Dean's Cafe. So it's still alive and well.
Thank you, Chief. Mr. Trent?
Yeah, Chief, how are our officers doing? Because this has to be draining on them.
There are 3 significant issues that I've identified since joining the fire department, sir. And the first one is the potential for sleep deprivation of our first responders. When I was in the oil industry, we knew who worked more than 12 hours a day, 14 hours a day, and pretty much 16 hours a day was the absolute cutoff. As I sit here before you right now, I cannot tell you how many EMTs or how many paramedics have exceeded an acceptable number of hours working. That's our number 1 priority right now, is to look at the department and to see how we can balance the workload and identify those people that might not be getting the restorative sleep that they need. We can test for marijuana, we can test for heroin, we can test for alcohol. There's really no good scientific or medical test for
Sleep deprivation.
but it's very much a concern, and we're working hard to correct it.
Well, if there's anything we can do, let us know,
Especially
Chief.
in high pressure.
Thank you, Chief. Ms. Green Jackson?
Thank you, Mr. Chairman. So I suspect that, based on what you just said, that the fire department will probably have a budget shortfall for 2015?
We met with the mayor on Monday, and right now we're projecting that we'll be $650,000 overspent.
Okay, and this issue has contributed to that?
It has not singularly contributed to it, Mr. Gray Jackson, but it has it is a factor.
Okay, thank you. Thank you, Mr. Chairman.
Thank you. Mr. Steele, anything?
No.
So Chief, I don't know, in years past, it comes to me that there were firefighters who were also paramedics that were riding on the trucks, and that perhaps there's a way to shift off, I guess, because, so
That's exactly right. And
Is that-
and that's
is that
what we're
happening
looking at,
now?
yes.
that's one.
The risk response profile that we have in Anchorage, of course, it relies on the 13 fire stations and the makeup of the apparatus within each one of those fire stations. And right now, we're committed to filling 97 seats a day across the 13 fire stations, with 6 to 8 people out on any given day because of FEMLA vacations or illnesses. We actually staff for 105 per day. We have 3 shifts, so that's 315 frontline firefighters, paramedics that we need to keep the full response profile alive. And we have EMTs, 1, 2s, and 3s. Of course, we have paramedics, and then we have advanced ranked paramedics, where people will promote from the firefighter paramedic rank into engineer, captain, or senior captain, and they'll keep their certification. And we have those both on the apparatus, the engines, as well as the truck companies, and of course staffing the MICUs. So we're looking at that entire complex mix to ensure that it's well balanced and that we're not burning out people. But it does get a little bit complicated, and so we're looking at how to best balance the stations in order to fulfill the response profile that we have, but not to significantly degrade the acuity of any one individual because of their sleep status.
Chief, a follow-up to that is, each of the MICU transports has a, generally, am I correct that there's a billing that comes with that to the patient?
Yes.
And if this person who's been transported 21 times, the person 14, 11, are they in a position, do you know, are they in a position where we can recover costs? What's the dollar amount for transports, do you know?
An ALS, the Advanced Life Support Transport, has a paramedic on board. I believe is $950, flat rate plus mileage. And a BLS transport, I believe, is $750. And we do have our financial folks, Mr. Holman, looking at who has been transported and how much we have been collecting. Of course, that's a secondary concern. The first concern is
Well, of course.
the status of the patient.
The question is, I guess, is if we're looking at it from a per patient, you know, who eats that cost if it's not covered, recuperated from the billable?
I suspect I know the answer, but I'll share that with you later.
Thank you, sir. Any questions from the Chief? Chief, I know we had an academy that you were working towards. Do you have an anticipated date? We're starting in, say, January, February?
We'll be testing in January. The academy is actually going to start about mid-March. We'll graduate that class mid-June. So they should be accountable for staffing in the mid-August timeframe. We're seeing the same kinds of numbers we see when we do run academies. I think we're well over 250 applications so far. The challenge that we're going to have is, if we're looking for 25 slots to be filled, what's the mix between EMTs and paramedics? And if we don't get the necessary number of paramedics, then we may leave seats open to run a supplemental academy later in the year for the paramedic staffing. But the way we balance the city is really going to be critical, because that's going to determine the actual number of paramedics that we need. And we're going through that exercise right now.
Mr. Steele?
Who has a medical training program for paramedics?
Most of them are out of state, and we actually do have 2 employees right now who are studying to be paramedics. I mentioned last month that I attended, at the invitation of Dr. Mike Levy, the Resuscitation Academy in Seattle. Seattle has a very advanced, very sophisticated program called Medic One. and they have a Medic One Foundation. And that foundation actually pays for all of the paramedic training, which can amount to about $35,000. If you look at room, board, salary, and training. I've talked to Dr. Levy about us appending to that Medic One Foundation, which they offered us to do. But he reminded me, we have a local foundation called Lauren Marshall Foundation that we would be able to use. So one of the things that we're looking for as an initiative in 2016 is establishing our own Medic One type nonprofit funding for paramedics. And that will amount to us to knocking on people's doors and asking for contributions, just like any 501c3 would do. But it's another avenue to entice folks to going into. It's a very extensive,
Get in the hospital, I'm sure. that-
inexpensive,
Tribute to them,
And just two other quick things, if I might. We did have promotions also. You recall Jim Vignola was recognized at the last assembly meeting for his 25 years of service. I don't know how you get to retire at 48 years of age. I must have missed that last year.
Smart, that's how.
But Jim moved on, and we interviewed and promoted Assistant Chief Jody Petrick, who was over our training and safety division, and she is now the Deputy Chief of Operations. And Eric Boyd, who is one of our battalion chiefs, was offered the position of Assistant Chief over training last evening. He has to go through the perfunctory hiring tests, if you will. But I suspect since he's an active DC right now, he should pass all of those. And then we will, in fact, we have a posting open right now for a new battalion chief within the fire department. So we've got some good turnover. And Jody joining the senior ranks helps with our diversity statistics. So that's very much appreciated.
Thank you, Chief. Ms. Great.
Thank you, Mr. Chairman. I had a note, I was going to comment about that. Thank you for the email that you sent us regarding Jody, and I sent her congratulations email. And so we still have two deputy chiefs.
We have a Deputy Chief of Operations,
Right.
and then Eric Schooneman, who is the Assistant Chief of Emergency Medical Services, reports directly to Jody.
Okay.
The other two, Assistant Chief, is an Assistant Chief position that's vacant, and a Deputy Chief position that's vacant.
That's still vacant?
So
Okay.
those folks that reported to those positions are my direct reports.
Gotcha. And so all the deputy chief positions, what non-rep step grade are they? The deputy chief positions, all of them? Because they're non-reps, correct?
They're non-reps.
All of them?
Yes.
Okay, that's what I thought. What
The
grades?
the
I'm just
battalion
curious.
chiefs and above are not represented.
Uh-huh. What the
I
deputy
know
chiefs aren't either,
The
right?
battalion chiefs are grade 18s, I believe. The assistant chief is a grade 19.
Right, and the deputy chiefs are non-rep too?
Yes.
Okay.
The challenge we have, very envious over the numbers of folks that were applying for the positions. We opened up, as I said, the assistant chief of training. We had one applicant. And when you move from battalion chief to deputy chief, you take a significant cut in pay.
Right, right.
And if I may add, pardon cutting in, but we had experienced the same problem, and that's why I was so impressed with the lieutenants stepping forward for these captain spots.
If I can follow up?
Yeah, Commissioner.
So how do you deal with that situation, or do you?
Well, we were successful with Alex, and a number of years ago, we were successful with Jody, because she was with the fire service on the state side when she joined our particular department. We're working with the administration to balance salaries such that there should be, and there should be an aspiration for all folks to continue to grow personally and professionally, so that you would want to become an engineer, become a captain, become a senior captain, battalion chief, and then aspire to become assistant chief or deputy chief, and even to the fire chief position. But right now, if you take a $20,000 a year cut in pay, it's very difficult. So, working with the administration to see what might be done about that disparity. And then secondly, hopefully encouraging, like we have Alex, and as we did years and years ago when I was the city manager, when we got a fellow by the name of Rob Hume to accept the position. You become part of the senior leadership team, so while you may lose a few dollars in the paycheck, you get the opportunity to influence the direction of the department and practice leadership in a different way. And so, if you're looking to advance yourself, it's a great training ground. And sometimes you have to sacrifice in order to acquire new skills.
Right, I understand. If I could follow up, Mr.
Yes,
Chairman?
ma'am. Yes, ma'am.
And just on a personal note, I really look forward to seeing those changes because it's really difficult in this day and age to get promoted and then take a pay cut to $20,000. So I look forward to seeing a code change that represents, fixing that issue. Thank you. Thank you, Mr. Chairman.
Thank you. And I guess to both of you, that's one of the challenges that I do recall when you, Chief, may have this in your past life, that they had steps under each pay grade or in the classification. And I recall that police, I believe fire, might have been one other that I think MLMP had what they call the X factor or off scale. And it seemed to me like a temporary fix that should have been addressed over the years.
It is and it was. In fact, there's only one employee left in the Anchorage Fire Department that is an 18X.
It's that's one of those things that should be addressed properly. It's proper classification and pay commensurate. Okay, and before we move on, Ms. Freeman, just 1 second, I'm going to loop back. Mr. Trainee had a question, you forgot that.
Jack, I've got a question for you. Have you been working with Erica on the new marijuana ordinance that was written, given us today? I've sent it on to P&Z. Have you looked at that and the duties that you'll have to do in code enforcement to make
I
sure?
don't see any duties in there for us yet.
You might want to take a look at it. She's a new version out today. I don't know if you've
Oh,
seen
great.
it. So what I'd like you to do is just
I'm
look
looking
at
forward
it
to it.
and let us know.
Okay.
Because I think there's a lot of code enforcement involved in making sure the businesses that want to get in that area conform to our codes. And that would be, I think, you. So just take a look at it and let me know.
I will.
Because if we need to increase your staff, I want to know ahead of time. We've got first quarter budget revisions coming up in April, so we can always pick it up. I just want to see what we can do to help you,
I think that, okay, I'll read it and then.
if you would. If there's nothing in there, just you let me know, but I just,
I didn't see anything in the one we looked at the other day.
okay.
And that's specifically what we were looking for, to see if they're gonna handle it as they do, alcohol licenses for the planning department to be responsible to vet the businesses, as opposed to us to enforce what they've approved when it's done.
Because somebody's going to have to go and check the business to make sure.
You're right.
And that's probably going to be your office.
I would imagine so.
Thank you.
While we're on that vein, Ms. Fawcett, I don't know if you've read the massage establishment ordinance that's in the works. It's not been introduced, it's not in the mill as far as process, but I'm not sure. We've had some concern amongst the licensed massage therapists because they think that, they lobby real hard to move their licensing, if you will, to the state, reserved to the state as individuals, but it's actual businesses that we're looking at addressing, the actual establishments, trying to reduce, if not eliminate, the ones that are operating off books, so the ones that are operating outside the zone of norm. And so, once again, there's several things that are enforceable or inspectable that, so I know Ms. Honest is a replacement, if you will. Her predecessor was deeply involved in reviewing, so that's something that, we actually had a meeting here not too long ago back with several people from the industry, and they're really upset, so it's something you might want to review if you haven't already. It's something that might, I think what Mr. Training's onto is that the municipality, through our assembly, if we're gonna create a law, we have to have somebody that's gonna inspect it to enforce it. If that's the case, it's gonna take some funding to make sure it's done appropriately. So if you look at it as consideration.
Thank you.
Okay, Ms. Freeman.
Thank you. I apologize in advance, I have to leave. I went to go to another meeting, so thank you for being so timely. We have been very actively involved in the marijuana regulation analysis for the municipality. Our environmental health staff, under Steve Morris, our deputy director, has been working extensively with our legal department to analyze our role in that.
Go ahead. I'll get to you when you're done.
And we will have, that is still being developed, the role that the health department will take, but it's very connected to food sanitation, inspections, budgets related to the enforcement of these codes and the analysis of the different products that will be produced and the process in which they produce this. And of course, APD and our friends at AFD are also having to look at these issues because there are many, many elements to implementing marijuana regulations and the products involved in that. So we'll be keeping you updated on that. We participated and led for the Emergency Operations Center a cold weather exercise in which we had to mobilize about 1,700 community members. And this, again, is an exercise and setting up a mass care facility as well as the pet care plan, and that went very well on November 5th. We are also now, we're very fortunate to have found warm storage for our Wellness on Wheels mobile health clinic, so we'll be able to utilize that more fully this winter. Solid Waste Services is providing us with warm storage out of the landfill, and so we will be looking forward to using the mobile health clinic in the winter months. And those are the primary updates related to public safety, if you will. If you have any questions.
Yeah, Mr. Train has a question.
One of the things that came out in that ordinance that Jack's got a copy of is odor enforcement. Odor? And I'm not sure that he's gonna do it or you're gonna do it, but I understand there's some machine they've got that can test the odor. It's one of those areas that one person can smell and another one can't. I just wanna make sure we've got, if this passes, we've got the ability to enforce it.
We are addressing that issue in the analysis of all of the implementation of the regulations.
So would your office be going out there to detect it, or would you be having Jack go out for code enforcement?
I'm not sure. I think we're still developing those
Okay.
roles as literally every week this is evolving.
Well, just let us know, because like I said, it's
Sure.
going on now to P&Z, and then from P&Z, they'll hold their hearing, so it'll come to the assembly. I'm looking about 2 hour work session in front of the assembly on it. So we're gonna tear this thing apart line by line and make sure what works and what doesn't. But it goes live, I think, in February, so we've gotta have this thing in place before
Yes.
the state law kicks into effect. Anyway, that's all I had, sorry.
Thanks, sir. Any questions?
I was also going to comment, that's also an issue with some of the products that we may be processing in terms of odors or, we're going to try and locate them in the right locations such that it's not going to be a problem. But
Yes. That will involve ventilation and all sorts of systems. Many elements to it.
Mr. Freeman, I guess I would have just a follow-up question. It appears we'll have our budget next week, correct? Is that we're going to do our, from our agendas of budget? If successful, there's an expansion for animal control care, enforcement officers. How quickly can some of those folks, if it's approved, quickly would that be possible to fill those positions?
I am not, perfectly positive as far as the contractor or negotiations right now, but I would assume that it would be your standard recruitment process for Joy on, so I would assume it would be anywhere from 30 to 60 days at most. It would be top priority.
Thank you. It's been, as you know, something that's been discussed, and we've actually had many amendments over the years in the budget that hasn't always withstood its budget challenge in either end or vetoes. But we think we're on the right track.
Thank you.
I haven't seen anybody from Office of Emergency Management yet. Anything from the Mayor's office?
Yes. Well, you'd asked us to look into that smoking ban
Yes.
last meeting. So a little kind of amended version of that is being run through ER and legal right now. It talks about e-cigs. So we're kind of waiting to see what's going to come out of those departments before the mayor tackles anything new. So that's kind of our update there. And I've been talking with Dee, who's running it out of legal, and Karen Turner. I talked to her yesterday at ER. So they're working together on looking at amending some of our smoking policies. So
Thank you.
once we have an update from them, I'll let you guys know.
Is it my understanding, and I don't know who has the answer here, is it my understanding that no municipal vehicles, you're not allowed to have tobacco or
Right.
smoking in any municipal vehicle, right?
Correct.
Is it just smoking, all tobacco, or is it anything else?
I think it's just smoking, but I can double check for you.
Okay. And this is a good topic, kind of reminder, it's on the old business category, but it's the 19th, I believe it is. The 19th is UAA campuses, all UAA campus area is tobacco-free. Not just smoking, but tobacco-free. So if you have officers, employees who chew or whatever, just make sure they know that they have to go to a call. Just be sensitive to that. I don't know what their attempts are going to be. They're going to be dealing with both the employee and the students that's handling it. They expect a kind of a warning period for short, maybe through the first of the year, and then into the next semester they'll probably do a few more warnings and then go from there.
Since you work for UA, I got a question for you.
Yes.
So those that live in dorms, they can't smoke tobacco, are they gonna be able to smoke marijuana?
It's a good question. No, the answer is no. Currently, the university has, through its acceptance of federal funding, apparently they have to abide by the rules of federal law, which of course Controlled Substances Act of America, marijuana is still illegal. So they've actually put the word out that, marijuana is not allowed on campus. Now, that's the question on, it's like any landlord, you can have no pets, but I've never seen one where it says, no smoking. I know you have hotel rooms that you have to reserve so many that have smoking available in a hotel, motel setting, so is this a similar thing? I mean, this is I think they wanted to exempt out residential, but for the smoking and tobacco ban, because of the privacy in your own room, you're paying rent. But it's a good question and debate, but right now, there are no marijuana period.
Thank you.
Firearms, if you're living in the housing, by the way, have to be stored in a safe. You have them, you have to have them.
Too much intrusion.
A landlord, if you're renting a piece of property, somebody, you can say, this is no smoking, when you're looking at customers, but enforcement is a whole other issue.
We've had people come to us and say, I live in an apartment building, what are you gonna do about the marijuana smoke coming in my door? There's nothing you
I
can do
have
about
calls
it.
like that frequently.
It's, the landlord has to set the policy for their apartments. We can't tell them they can't smoke marijuana.
This is a
It's a cultural change, isn't it?
I have a woman that swears that smoke is coming through the wall, and there's no
Is that the
breaks
same
in
one
the
that
wall.
claimed the fluoride was leaching into her skin when she took a bath?
Maybe.
We actually had it happen at some meeting.
So, under new business, is there anything further from municipal property smoking designated plan area? I know that mayor's office report, is there anything from health department or code enforcement? What if that happened to be, is that an employee? I know you say you're reviewing it through employee relations and perhaps legal, but
Yep.
let's say it's a citizen versus an employee.
I think that's something that legal's looking at. I don't know exactly what that breakdown is. I mean, I know right now, like on municipal property, it applies to citizens as well, so I would assume, but that's something that Dee is looking
You can go
into.
out here and smoke them, right?
It's
right.
20 feet right now from a doorway.
I guarantee the people here are not 20 feet from the door.
Oh, no, not at all.
Ms. Gray,
Thank you, Mr. Chairman.
I
No,
can't
just
count
wanted-
well, but I.
It's cold out there. I'm sure they're not far.
Ms. Gray Jackson.
You tell them.
Yeah.
I lost control of me here.
No, anyway, the whole issue came up because a municipal employee at the library sent us this big, long email, talking about it. That's how, if you remember how the issue surfaced. But I'm glad that the mayor's office is looking into it and looks forward to a response when we have one. Thank you. Thank you, Mr. Chairman.
Thank you.
Mr. Chair, I just wanted to add that the state is looking at increased regulations related to e-cigarettes. And so typically we would wait to see what is initiated by the state, whether it's new legislation, et cetera, and then we could provide support for that within the municipality. So we have been looking into this extensively regarding e-cigarettes and the use of e-cigarettes on buses, in restaurants, in offices, that sort of thing, through the health department. So we'll keep you posted, and we're working closely with the mayor's office to move forward with this kind of concern, because it has been brought to our attention in probably years as well with e-cigarettes on the use of buses. And just as a note, e-cigarettes are unregulated. So the chemicals that are produced in e-cigarettes are unregulated. They're from all over the world. You can order things on the internet with the chemicals, and one of our concerns with chemicals is the increased access and utilization of emergency rooms because of children ingesting the liquid chemical that goes into the e-cigarettes. It is often marketed with flavors like bubble gum, fruit flavors, and this kind of thing, which we all recognize appeals to young people. So recently, the state issued a press release on the increased use of e-cigarettes with young adults, adolescents from 12 to 18. So the Muni is keeping a close watch on this and analyzing how we should move forward with it.
Mr. Train.
Just as soon as we find something up at the state, let us know. Because I tried to do it over here, get rid of cigarettes e-cigarettes over here at the, we're surrounding the PAC and couldn't get the votes on the assembly, so I'm looking forward to the state stepping up the plate on this, because it is a
It will be
problem.
in this session.
Because I was getting complaints from people at the library where they had somebody using a cigarette in the library, and they were told you can't do anything about it because it's not illegal.
It's not a tobacco product
Yeah, I know.
necessarily as we define it, so we are, as Nora is stating, we are working closely with the legal department with definitions and looking at the state moving forward with it, and then the Muni following that.
Thank you.
I might suggest you look at what the oil industry has done here in Alaska. East BP, ConocoPhillips, they've all written into their policies and procedures that e-cigarette prohibitions follow tobacco prohibitions. They treat them exactly the same. And a unique aspect about a e-cigarette, it actually can set off a fire alarm smoke detector, the vapor from the e-cigarette, if you smoke it close enough to a detection unit.
Is that the heat or is it
It's,
chemical makeup?
it's the chemical makeup. It's the mist. So for that reason, in all of the hotels on the North Slope,
I'm just thinking of that.
e-cigarettes have been banned. And then they just wrote the language that says it's the same prohibition as it was a tobacco product. Makes it easy.
Anything else, Mr. Anything else, Good. If I could, Mr. Trainee, since you just and handed out this, we're ahead of the schedule. Just a moment, Mr. Halcrow will be in attendance, but he should be here momentarily. Could you briefly discuss, if you don't mind, Mr., the highlights of 1921, if there's a few things that stood out to you that
It's new ground, and Eric McConnell and Amanda and some other people we sent down to Denver has done a real good job with this. It's new territory. What we're trying to do is make sure that we conform to state law, but we can also put some restrictions on it. Because land use is our area. It's like alcohol. Land use we deal with. And so it's the land use constraints that are put into there. And I want to see what comes out of P&Z, and then we'll come to us and I'll put your work session on it. We'll have a good document as we bring it forward for a public hearing on this somewhere.
this is good.
I wonder if the other states that have gone before us have some good recommendations on that particular.
Well, Eric has been looking at other states, yes. And some, like Washington State, has some requirement to do an odor tester. Go to odor, a machine that will test for it. And Colorado didn't do that. So we're trying to learn from other states. But I anticipate there's going to be a lot of people getting in the industry. There was at least 7 there at our earlier meeting that said they were there because they want to get into the business. I always find it interesting when you listen to radio and there's some business saying, call us really experts in marijuana in Alaska. I'm thinking the regulations aren't even signed by the state yet. How can you possibly be an expert on it? Not to mention the city regulations. But take a look at the document.
Chief, with your DEA background and previous experience, are there any areas that you might be able to assist in our efforts of trying to craft legislation in the area of, where these belongings or I guess properties may be, in accordance with perhaps any knowledge and experience that you've had? I mean, we've already heard the horror stories of explosions when people are trying to reduce into a liquid form and concentrates and things like
Yeah,
that.
extraction, so correct. And there's also for a public safety prospective responders and all the occupational health hazards associated with going to the sites, anything from mold and other contaminants. There's been research done on that and industry standards, recommendations, and so on. And as part of those studies with federal occupational health and so on, but I'd be more happy to assist the group.
We appreciate that. When it comes to the regulation side, like any business, there's fees involved. Like massage establishments, it's not really a significant number, but I think it needs to be addressed as best we can. I mean, no one knows what it costs to send 2 or 3 officers out. You could probably put a time meter on it. Each and every time you have to send a couple of officers to a call and then track it. Perhaps you could put a dollar figure to it. You send a fire truck with a code inspector or something like that. There's got to be a fee associated that, you know, if there's going to be these risks that our employees are facing and that we have to continually insist upon and make sure that we're respecting, there should be enough coverage there that the rest of the community isn't covering. I mean, I to be honest with you, I'm not sure we're doing it well enough in the alcohol industry, but generally in the alcohol, it's a bare shelf. The bar may be, in a restaurant, they're serving it in a glass, but bare shelves are a lot different than, I guess whatever it takes to extracting and the smell, the odors that come out. I mean, at a bar, it smells like, everybody knows what spilled alcohol kind of smells like. It is stinky. It's offensive odor, but generally dissipates as the farther distance you get away from the door. But it seems like the marijuana it's a whole new world. It really is a whole different thing to it. So it needs to. I think it needs to be a fair number that we have to rely upon on a yearly basis, so that if we're continually inspecting and/or potential for putting our people in harm's way, I think there's going to be a mitigation cost to that.
Well, one thing that's in there, it says the license would go fallow if the business is not operated for 6 months. They have to go back through another process to get a conditional use for that type of business there. I want to drop it down to 3 months because I think they're not active selling marijuana for 3 months in business. You need to drop it down.
Drop
Void
it.
it. Just void a conditional use. I'm not comfortable with 6 months. And there's another thing in there, they want them to go to community councils, but if they can't make a community council meeting, then they're allowed to hold their own public meeting. And I worry about that. And I'm going to be talking to Federation tonight. And I've been telling the Federation, people I talk to, that they need to change their process from only being active in 9 months of the year to being active 12 months of the year. Because they're not going to have the time to wait while they're closed down for 3 months and then bring it, because the state's going to move on these fast. So
When is the state's regulation, when are they supposed to be? Is it February?
I think it's February 26th or somewhere around there. You might know.
February.
What?
It's February, I don't have the exact date.
I remember it's 26, something like that for some reason. Anyway, we have a lot of work to do on this. And we'll get input out of B&Z.
Thank you. Since we're just ahead of schedule, waiting for Mr. Huckrow, we do have in our agenda area for audience participation. I know Mr. Millspaul's here. Is there anybody else? I know we have reporters. Usually it's kind of rare. I thought we'd be over it fairly quickly today, but Mr. Millspaul, is there anything you have from the university area or?
Nothing particular, no. We're just, big thing right now is the dog parks. And we're looking, getting more control of those. And, the university.
You want more of them?
Well, signage, yeah, we want more dogs. We love dogs. And, signage and people not controlling their animals when they're on the bike path, and bicyclists going too fast. All this stuff combined is they interfere with each other. That's the big thing right now.
To get rid of the beavers.
Mr. Trent.
Just if you want some changes, just let us know with the dog parks. Walking, through the system. There's a lot of anecdotal information I've heard. Oh, I knew there was a dog bite occurred at the University Lake Park. But when we try and track down, was it ever reported? Well, no, it wasn't. There's a lot of second-hand information that doesn't hold up when you look at reality of the question. And I've heard people say, we don't want dogs in a pristine park like University Lake. Well, I hate to tell them, but that's a gravel pit. It was never pristine.
Yeah,
It was never a lake.
Come to our community council and talk to us. That's the first level.
Yeah.
And you're right, not that many people.
Mr. Steele?
Yeah, I used to take my dogs there, but I have one that was attracted to the beavers, and she didn't know that she was going to lose should she get too close.
Got big teeth, huh?
But every once in a while, they transplant the beavers, and it doesn't take very long for them to put back.
I know that we have several people that have a place to be. I certainly wouldn't want Mr. Halco to come in and feel like it's an empty room, though. How about we take a few moments, if you'd like to get a sandwich or a piece of pie or something like that, take a break. Mr. Halco should be here shortly for an ACBA. And Chief, particularly, I know you got 2 o'clock, as I understand. There's some issues and questions about the downtown BAC and the bus stations. This might be germane to your area, but it's possible.
And we've been meeting with various individuals about that topic.
Very good. Mr. Millspaw, anything else? Ms. Gray Jackson?
No, well, yeah, actually,
Yeah.
I'm looking at facilities now, to run my commercial business.
Oh.
Just kidding, just kidding.
Let's take a pause. We're still, Ms. Honesty, do you want us to stand tape or I'll tape for now? I guess I'll tape for now. There'll just be a pause. If you've got one,